Causes of vomiting. The common causes of spitting up or vomiting vary according to age. During the first few months, for instance, most infants will spit up small amounts of formula or breast milk, usually within the first hour after being fed. This cheesing, as it is often called, is simply the occasional movement of food from the stomach, through the tube, esophagus, leading to it, and out of the mouth. It will occur less often if a child is burped frequently and if active play is limited right after meals. This spitting up tends to decrease as the baby becomes older, but may persist in a mild form until 10 to 12 months of age. Spitting up is not serious and doesn't interfere with normal weight gain. Best way to treat vomiting. In most cases, vomiting will stop without specific medical treatment. The majority of cases are caused by a virus and will get better on their own. You should never use over-the-counter or prescription remedies unless they've been specifically prescribed by your pediatrician for your child and for this particular illness. When your infant or young child is vomiting, keep her lying on her stomach aside as much as possible. Doing this will minimize the chances of her inhaling vomit into her upper airway and lungs. Note: if you are concerned that your baby is vomiting excessively, or seems unwell or distressed, you should seek medical advice. Vomiting in conjunction with any of the following symptoms could be a concern and require a visit to medical professional. Having less than 6 wet nappies in 24 hours. Losing interest in feeding. Being lethargic. Having diarrhea. Having a fever. The vomit having a very offensive smell, or if it consists of clear, bright yellow, orange or greenish bitter fluid. Home care. To treat vomiting and prevent dehydration, give small amounts of fluids at frequent intervals. Begin with ORS at room temperature. Give 1 teaspoon, 5 milliliters, every 5 to 10 minutes. Even if your child vomits, continue feeding as directed. Much of the fluid will be absorbed, despite the vomiting. As vomiting lessens, give larger amounts of ORS at longer intervals. Continue this until your child is making urine and is no longer thirsty, has no interest in drinking. Do not give your child plain water, milk, formula, or other liquids until vomiting stops. If frequent vomiting continues for more than 2 hours with the above method, call your doctor.